Dear friends, today, I would like to discuss the diseases related to the throat, such as inflamed tonsils, angina, and tonsillitis. These conditions are often considered challenging to treat, leading many doctors to prescribe antibiotics immediately for any throat ailment, even a simple sore throat. However, it is important to note that the frequent use of antibiotics can have harmful effects on the body, especially when the condition is chronic. In some cases, doctors may even recommend a radical solution by removing the tonsils. I once witnessed such a surgical operation, and I was taken aback by the amount of blood, pain, and tears experienced by the patient, a young girl. This made me question the necessity of such an invasive procedure when throat conditions can be effectively treated without resorting to surgery. Today, dear friends, I would like to share with you some valuable knowledge on successfully treating throat conditions such as chronic tonsillitis or sore throat. While these remedies may not guarantee a 100% success rate, they have been proven to be effective in approximately 80 to 90% of cases. Firstly, it is not necessary to immediately resort to antibiotics for a sore throat. Prolonged and frequent use of antibiotics weakens the immune system, and many throat conditions are not caused by bacteria or viruses at all. It is important to note that antibiotics do not work against viruses. Secondly, the removal of tonsils should only be considered as a last resort. Tonsils act as the body's defense against infections and play a vital role in our immune system. Removing the tonsils weakens our immunity and increases the chances of contracting various infections. Furthermore, after tonsillectomy, there is a risk of developing serious heart or kidney problems, as well as triggering allergic diseases. Instead of resorting to surgical removal, let us focus on simple, effective, and inexpensive ways to treat throat conditions. One such forgotten remedy is called blue iodine, amyloiodine. This unique and highly effective drug has proven to be more effective than many expensive alternatives. To treat throat conditions such as tonsillitis or sore throat, dilute 2 tablespoons of blue iodine in a glass of lukewarm boiled water. Gargle with this solution 3 to 4 times a day, and refrain from eating or drinking for 15 to 20 minutes afterward. The treatment course usually lasts from 3 to 7 days. However, many patients report relief from acute sore throat within the first 2 or 3 days. For chronic tonsillitis or enlarged tonsils, the treatment may extend for about 7 to 10 days. Please note that this medication for gargling the throat is suitable for children over 5 years of age and adults. By following these simple steps, we can effectively treat throat conditions without resorting to invasive procedures or unnecessary antibiotic usage. And now, let me introduce you to an additional remedy that may sound unusual but has proven to be remarkably effective. However, I must emphasize that this particular remedy should not be used for more than 2 or 3 weeks, as it can affect the thyroid gland. Therefore, it is not suitable for individuals with thyrotoxicosis, autoimmune thyroiditis, pregnant women, or nursing mothers. For those with thyroid problems, there is an inexpensive yet powerful antiseptic solution that can be used for gargling the throat. This solution consists of chlorhexidine and miramastine. Gargle your throat with these preparations 3 to 4 times a day for a treatment course lasting from 5 to 14 days. In the case of chronic tonsillitis, you can also perform a special self-massage technique. Place one hand on the back of your head and firmly rub the neck in a downward motion for about a minute. Then, without removing your hand, place the other hand under your throat, specifically on the tonsils, and continue rubbing for about 20 to 30 seconds. Immediately after this massage, perform a throat gargle. This massage can be done up to 2 or 3 times a day. To enhance the treatment of chronic tonsillitis, there is a relatively inexpensive device called a quartz ultraviolet irradiator, which can be used at home. This device comes with special attachments for the throat. However, it is important to use this device with caution and follow the instructions carefully. It might require some mental effort to understand the proper usage, but if used correctly, the benefits for chronic tonsillitis can be tremendous. It is crucial not to overuse this device due to the ultraviolet light involved. Treatment with the irradiator should be done in courses, with a maximum of 2 times a year. In addition to these methods, it is essential to focus on improving your immune system. In my opinion, One of the most effective ways to boost immunity for tonsillitis is through subcutaneous injections of aloe. This treatment involves receiving 10 to 20 injections in the arm over a course of 1 year. Please note that these injections should be administered subcutaneously, not intramuscularly. Alternatively, aloe can be used in another form. You can purchase aloe juice from the pharmacy and consume 1 teaspoon of juice 1 to 3 times a day before meals. The treatment course typically lasts for 10 to 15 days. While these remedies may not be everyone's preferred method of treatment, they have shown effectiveness in managing chronic tonsillitis. I would like to reiterate the importance of following the instructions and recommendations provided. Here are some important points to consider when treating throat conditions. Increase your water intake. Drink plenty of warm boiled water throughout the day. It would be ideal to drink 1.5 liters of water. This will help moisturize your throat and improve the healing process. Use cranberry and lingonberry morsels without added sugar. These drinks are also very useful in treating throat conditions. They help reduce inflammation and have antimicrobial properties. Avoid consuming sugar and sugary drinks. Try to eliminate sugar and sugary drinks, especially carbonated drinks, from your diet. Sweets and sugar create a favorable environment for microorganisms, which can slow down the healing process. Visit the dentist. If you have chronic tonsillitis or frequent sore throats, it is recommended to have your teeth checked by a dentist. Sore throats often occur against a backdrop of oral infections that have not been fully treated. Pay attention to psychosomatics. Sore throats such as chronic tonsillitis or frequent sore throats can be associated with psychosomatic causes. Children who cannot express their emotions and women who suppress their emotions are more prone to these diseases. It is important to learn how to express your emotions effectively so that they do not build up inside. Physical and material treatments. There are many recipes and treatments for throat conditions such as chronic tonsillitis or sore throat that can be found on the internet. However, from my experience, the methods I have described are the most effective and help in most cases. Please share your treatment results in the comments below the video so we can find out if these methods helped you and how quickly. Thank you for your attention. If you are interested in the topic of psychosomatics or if you have any other questions, please leave a comment. Be well and all the best to you.